what Dr. Tan has said, Barrett's is something that we have to keep a follow-up on, because Barrett's actually is almost like a precancerous condition. So in patients who have a lot of reflux disease, which typically happens if they drink a lot, take a lot of fatty meals, have poor digestion, and sometimes they have this hiatus hernia, it predisposes to reflux. Then the esophagus gets exposed to the acid that's formed in the stomach and undergoes the changes that Dr. Tan was talking about. And that definitely predisposes to cancer. So a patient with Barrett's will have to remain on lifelong follow-up to try to ensure that if any cancer develops, it is picked up early, and that the appropriate surgery should be done as soon as possible. I guess it is very difficult to say what the diarrhea is due to. I think that food poisoning happens, and if food poisoning usually happens in a group. So if you have a bunch of people who have gone to a restaurant, or everybody in the family is having the same symptoms of diarrhea because they ate the same dinner, then yes, probably food poisoning. But if everybody has gone to the same restaurant and the person is only one person is sick, then it may not necessarily be food poisoning, but it could still be infective colitis. Infective colitis still means that the person has an infection in the colon, and that could cause the bad diarrhea. I think the important thing is also how severe is this diarrhea, how many days it lasts for, and how often is this person getting diarrhea. Everybody gets, on-off stomach ache, on-off diarrhea, sometimes, vomiting and all that. But if it happens once in many years, we are not worried. But if you have somebody who is having diarrhea, and this diarrhea keeps on going on, so we call a change in bowel habit. We used to pass motion one time a day, very nice stool, and now recently the stool has been getting softer and mushier, and it becomes very small, and it's consistently in this phase, and for weeks no change, and the person is losing weight and all that, then I think definitely the person needs to seek medical attention. Okay, so you don't Nexium for a long time. I mean, firstly, we don't normally prescribe it for a very long time, definitely not for 5 years. And the reason is because Nexium is usually used for specific conditions. And if the person is not responding well to the condition, even with the Nexium being on for a while, then maybe Nexium is not the correct treatment. Maybe something else more permanent needs to be done. So it's dangerous also because I guess I have patients, or rather not patients, but patients that I've heard of who have gotten a scope done, and it is found that they have gastritis or they have some reflux and so on and so forth, and they are prescribed Nexium or omeprazole, Losec by the doctors, and sometimes some of these patients have even a gastric ulcer, a stomach ulcer. So then the doctor gives them the treatment and tells them, okay, in 6 weeks time, 2 months time, we need to scope to make sure that the ulcer has healed. But the patient doesn't want to have the repeat scope. So the patient goes to another doctor and says, I did scope already, I have ulcer, can you give me Nexium or omeprazole? And then they take the medicine and they say, yeah, I feel better, but I think I need some more. Then they get another prescription. And after the second or third prescription, the doctor says, I think you better do another scope. And the patient says, I don't want. So he goes to look for the third doctor. So every 3 or 4 months, the patient changes doctor. And so it's on the Nexium or the omeprazole for a long time. But if this ulcer is not healing, then the worry is that this ulcer has got cancer cells inside. And that is the reason why doctors say if you take the medicine and you cannot live without the medicine. The moment you stop, you have problem. Then we need to have another look to find out really why is it not healing. there are a couple of common conditions, and when you say cyst is a very generic term because cyst can mean a lot of things. I think what the person means to say is usually you refer to tumor, and the tumor can be cancerous or non-cancerous. So patients can have polyps in the stomach, and polyps in the stomach are quite common, and most of the time the doctor will explain to the patient and say you have some cyst in the stomach. Actually, it's not cyst, it's polyp. But the polyp in stomach usually is not dangerous like polyp in the colon. Polyp in the colon, like what Dr. Tan has explained, needs to be removed because polyp in the colon can change, has a higher chance of changing to cancer. Polyps in the stomach most of the time will remain the same size for many years. And yeah, every now and then you can put a scope in to have a look. And when I do a scope and I see some polyps, I usually biopsy the biggest one to test to make sure that there's no cancer, because you were asking me how do you know if it is cancer or no cancer. And so we will biopsy the biggest one, and generally speaking, if the biggest one is negative, the rest are okay. There is another condition known as GIST, not cyst, but GIST, gastrointestinal stromal tumor, GIST. That is a tumor usually in the stomach, and interestingly, it is not inside the stomach, but it is usually in the wall of the stomach, and sometimes it comes out. When we do a scope, we may not see a tumor. Sometimes we will see just a very interesting ulcer. We call it umbilicated, but that is a medical term. All right, when we see that, we are very suspicious. Or sometimes we do not see a tumor in the stomach, but we see that there is a bulge. There is a little hump in the stomach, and we suspect that maybe the tumor is in the wall of the stomach and on the outside. So in patients where we have this suspicion, we will ask the patient to go for a CT scan. And the CT scan will be able to show us the tumor that is in the wall and on the outside of the stomach, even if it cannot be seen on the scope. No, bloating is a very common thing, and I don't think that people get cancer just from being very bloated. And the first thing I would do is to check what kind of diet the patient is on. I had a patient who saw me the other day and says that they are very bloated, and we scoped, and the scope didn't show any problems. But later, when we were talking about what she ate at home, she loves to eat garlic, she loves to eat onions, she loves to eat spring onions, and she said every meal she eat one bowl of garlic. So I say you stop eating the garlic for a while, and you come and tell me if you are better. And 1 week later, she said no more bloating. So the diet is important. If you eat a lot of beans, green beans, kidney beans, red beans, you eat a lot of lentils, you eat a lot of cabbage, cauliflower, onions, spring onions, garlic, you can be bloated for a long time. The second possibility is also gallstones. People with gallstones can be bloated, especially after eating very oily meals. So if the scope doesn't show anything terrible, no gastritis, no problems in the stomach and colon, I would do an ultrasound of the gallbladder to see if there's any gallstones. Because if they have gallstones and they always get bloatedness after eating oily food, then the surgery that they will require is a removal of the gallbladder. So these are the common things. Of course, there will be patients who have what we call irritable bowel syndrome, and they are very sensitive to different types of food, and certain foods will cause a lot of bloating, and they will tell you that they are bloating for many years. I will tell these people to keep a food diary. Every day they write what they eat, and they write whether they have bloating after that. Then they will, over the next 2 months, be able to identify food that doesn't cause them bloating and food that does cause them bloating, and they will avoid all these foods that cause them problems, and then we will observe. Sometimes we can give medication to relieve the bloatedness, but of course it is always important that we exclude serious conditions before we just say, you know, it's just bloating for no reason. But my
Okay.
suggestion is that if you have patients with this kind of symptoms and they cannot find an answer, then better fly down to Singapore and look for Dr. Tan or myself, because whether it is scopes that they need or gallbladder problem that they have, or unfortunately some of them will have cancer, we will deal with all of them.
Jangan lupa like dan subscribe.